we'll get started to honor the time frame for those that are here. We appreciate you being here. Again, I'm here with Dr. Paula Kruppstadt from Shenandoah, Texas, and she's a board certified pediatrician, among a lot of other credentials, military, and I'll let her explain that. I'm Kim Look with Ozone Training Academy and have evolved over time from many different training and educational platforms and entities, and now with Ozone Training Academy. So we introduced Dr. Paula Kruppstadt as a member of our board, as the specialist that she is, as well as a ozone and UBI and IV, among other things, user. And so she's a speaker. She's presented in many different circles. In fact, I just saw you on Doctor's Talk.
Yeah,
They
Doctor Talks.
just presented it, and I watched a little bit of it. I meant to post it in our platform to say,
Oh,
watch this. I know that Doctor's Talk is Doctor Talks is meant to be for the public, but at the same time, you had such good information there. But you've definitely made your way into certain organizations and as a renowned, not just specialist, but I think you have such a great way of putting data to what we do. You know, you've
mm,
got evidence and you have such a great mind for um, cell biology and microbiology and biochemistry and so forth. So I always get a lot of pleasure after out of listening to you. I've been to your practice. We did our first training over there years ago now for ozone and UBI, and you helped me. I helped you. Whatever we collaborated on the pediatric ozone protocols that we currently provide. And
mhm.
so, as again, that specialist, but utilizing a lot of the things in functional medicine and probably even into longevity and so forth, I wanted to bring you on and help those who run into kids and end up treating kids or have kids of their own and how those protocols should be managed and relatable. Um, and also, you treat plenty of adults too. And so, with those specialties, I wanted to have a conversation with you that hopefully will help broaden the scope and the horizons of all those that use
Mm.
ozone and treat these conditions, mold, Lyme, PANDAS, all of it. So, you tell us your version of your story.
Well, thank you for that very nice introduction. I'm an Air Force brat, oldest of four kids, first person to go to medical school, and I took a military scholarship. So I went to a University of Texas Medical School in San Antonio. They've changed the name to Long School of Medicine. Graduated a long time ago in 1990, and then I did a pediatric internship and residency at William Beaumont Army Medical Center in El Paso. And that's where I met my husband, who's a West Point grad, field artillery officer, was in the First Persian Gulf War. And we moved to Houston in 1995, and we have four children, ages 19 to 31, and we have two grandchildren. And uh, my own health failed, and I ended up looking into functional medicine, and it changed my life. And then I opened my own practice in June of 2015, and that the rest is history. So we have five medical providers total and two genetic providers because precision genetics is what kind of saved my life. I had ballooned up to 300 pounds. I took 27 years of antidepressants, probably 11 to 13 different drugs, and now I don't take any antidepressants. And uh, I'm really grateful to be able to serve families and womb to tomb. So we have family practice on our team in addition to pediatric nurse practitioner, and we love ozone. So I'll just leave it at that and just to open it up for however you want to take us down this road, and we'll just answer a free-for-all on all the pediatric stuff.
Awesome. I appreciate that. And I want to say your husband, attorney turned health coach.
Yeah.
And I've spent some time with you on the business side of things with through your ups and downs and my ups and downs. And And maybe we'll get to talk a little bit about that. I know at one time you were like, I really think all practices should have health coaches. And kind of, you've spent a lot of time investing in your practice growth and your leadership growth and so forth as well, too. So maybe we'll have some time to get into that because that's very valuable. Like you said, lots of providers in your practice, and you've even kind of scaled down recently. It was at one time bigger, several locations. And so there's a whole element of navigating that's beyond the medical training, right? So,
Yeah,
um,
exactly.
for those listening, if you missed it, again, use the chat feature. We don't have the voice option for you to chime in, but the chat feature should allow you to ask questions and to have conversations, hopefully. And this is being recorded, so if you want to review it, we will store it or host it in our platform, our Ozone training platform, which you can find on our website and go to community if you're not already there. But that is, again, a kind of a password protected and private platform for providers of all types. But definitely, we first start with Ozone and then we broaden out beyond that to just network together and to help each other and to learn from each other. So we will post this webinar there. Also wanted to quickly say we have neurotherapy and EBU training this weekend. It's sold out, but we have one scheduled of both. Well, mostly neurotherapy. We don't have a neurotherapy in April, but we have both of them scheduled April, May, June, all the way through, I think, September, October. My staff was really getting on me to put those together. So that's the fast track training here in Idaho. If you want to come learn about it, you bought equipment and you want to get trained, you have new staff, you want to send them here for EBU and high dose. But also the neural therapy training. I co-teach that with Christina Finnerty, who is a nurse practitioner here in Idaho with me, and it's fantastic. We love having and hosting. And neural therapy is a treatment that helps so many, and I feel like um, it's growing in popularity through presentations and conferences and those that are speaking about it. But I think the other reason why it's growing is because the nervous system is such a mess in the majority of people at an all-time high. That it's called on neural therapy and procaine training. Also to procaine training, we're doing a procaine IV presentation on Tuesday. And you can still register for that. We charge 99 bucks, but it's virtual. So I'll be presenting Tuesday night. I don't want to throw out a time. Holly can put it in the chat. I think it's 6 p.m. Eastern time. So we will be teaching on an IV therapy or an IV constituent, what do we want to call it, ingredient um, each month, and this month is procaine. Um, Paula, do you use any neural therapy or procaine?
Yeah, we have Procaine IV that we use. We haven't used it a whole bunch, but right now I've got a few people, very challenging, two men with ALS and Lyme disease, and
Mhm.
one of them is experiencing a lot of pain with his herxing as we're treating the Lyme. So I'm going to really encourage him to do the Procaine. We don't do a lot, but yeah, we've onboarded that and we have our um, policies and procedures and the king of medicines.
Yep. Yep. Yep.
Yeah.
Um, okay, I'll come back to that. I want to back up a little bit to Ozone. When I was there years ago, you already had an IV room, you already had a very functioning and successful practice doing a lot of things in terms of, as you mentioned, pediatrics. But you have a specialty within PANS and PANDAS and Lyme and mold and so forth. And then we come in and teach you ozone and you start to apply it. And I've interviewed you, I think you before, but you've also been speaking at different conferences on how ozone applies to these things. So, in a nutshell, how do you describe, whether it be to providers, which is who our audience is here, or those families and parents and adults that you talk to, how do you explain ozone? What's your definition?
Yeah. So basically the conversation in the exam room is that, ozone is a triple oxygen molecule. We don't breathe it in. Everybody gets hung up on that. But when ozone, it's highly reactive, meaning when it hits fat or protein, it converts to a really stable molecule called an ozonide with a north and a south pole. And for example, if your child has an ear infection, we can put it in their ear. And when it hits the eardrum, it converts to this ozonide. And if there's an infection and fluid behind the eardrum, it it will kill those organisms, and we can't post that on social media, but it will disrupt the bacterial membrane, or if it's viral, it'll disrupt the viral envelope and get rid of those bugaboos. And if your kiddo has a high fever and they've got pus, then we might do a shot of an antibiotic in addition to ozone, but we're not creating resistance if your kid has had numerous antibiotics and things like that. And so we have a lot of parents, that will buy a pack of three. We'll see them on a Thursday and we'll give them ozone in the office, and then we'll have them come back Friday. And then I just say, hey, if they're still, snotty and gunky, we'll do it again on Monday. So that's how I explain it, just very simply, like in the little, 45-second type explanation. And we just give them all the, handouts and things and just say, just think about it, read about it, and just send us some messages back. But just really simple, kind of gloss over it. But then we offer all of our in office, we bring our ozone cart into the room, and we do that. And then if kids are autistic, we get a little bit of a deeper dive. And you're here because you want your child to speak better and have more critical thinking and be able to express things. So we know that ozone is like supercharged oxygen, and our mitochondria that you never wanted to hear again after high school biology or college make energy, or ATP. So if we put it in their ears, it's so close to their brain, it'll help them with those things. And so that's kind of the verbiage we say over and over again. And we have a lot of families that choose to do, a pack of three or a pack of five or whatever, depending on how sick they are. That's how I
So
explain it.
is ozone in the ears your go-to for kids most often initially, whether it be an acute ear infection or whether it be a nonverbal autistic child?
Yeah, yeah, because a lot of these kids can't hold their breath. And we don't do nasal ozonides in the office based on office space, to sit there with the nasal cannula and do that. But we have another way of doing that, which we can talk about later, unless you want to do that now.
Yeah, well, I mean, we were just chatting before we made
Yeah.
this live, and it's like all the new stuff, right? So, ozonated glycerin's the new thing.
Yeah.
And I think above all, one of the primary uses would be with kids because
Yes.
it's so safe, it's easy to apply, and they can nebulize it.
Yes, we use the syringe method here in our clinic. We don't screw around with the stethoscope. I just think it's a lot easier. We have a cart that has, we go to Costco and buy the big, gigantic olive oil thing. And, we stick our a glove finger and, pour a little olive oil out and put a little olive oil in each of their ears and do one, two, three, hold it for 10 seconds. But the go-to now and is the Puro 3 ozonated glycerin. I've got it sitting here on my desk, and I usually tell parents, get a 1 cc syringe, or if they're here in the office, I'll literally go into our IV room and just give them one of these to take home and just say, okay, and we'll send this hypertonic saline to their pharmacy, and we'll have them pull up no more than a half of a milliliter, but I'll just say, just do 2 to 3 drops. And they nebulize that. And many times we'll do biocidin liquid drops. Biocidin by Biobotanicals has 18 different antimicrobial agents in it. That's a biofilm buster. And if you have an account with Biobotanicals, they have the studies for eradication of biofilms in the nasopharynx. And then if you throw in the ozonated glycerin, it's the next best thing to having a home ozone generator. And you bust the biofilm and you give them the ozonides, and it's like it's magic. So it's wonderful. Um,
So you feel
some
like even from the ear and nose perspective, you're busting biofilms. Doesn't have to be systemic.
Yeah, a lot of these kids, we treat a lot of children, neurotypical and not neurotypical. They're neurodevelopmentally challenged. And if they grow an organism in their nose called MARCoNS, multiple antibiotic resistant coagulase negative staph, it's not an infection, but it's a colonization, or even just for sinusitis. And we uh, bust that biofilm in their nasopharynx. But even though it's going on here in the nose, we'll typically put them on a systemic binder, like it just depends what we're treating. So some type of a binder. Um, yeah,
So syringe method into the ears, which is the protocols that we put together that people can access through the platform as well. Um, And I will be teaching a class later on this summer on insufflations and non-IV ozone applications. So we'll get into the depths of that and I'll be producing more materials on it. But that said, syringe method and the concentration ranges and the volume ranges that you can put into the ears, it's so simple on kids.
it
And
is.
then the ozonated glycerin in terms of some nasal stuff, and both go into the brain, right? Nasal,
Yeah,
the lining here goes up into the brain, and you could look at ozone as busting biofilms, and you can look at ozone as decreasing inflammation, and you can look at ozone as oxygenation. Like just
yeah,
if we just got oxygen to the brain, decreased inflammation around the brain and nerves, and also targeted some of these infections or colonizations,
yeah.
then what types of results are you seeing?
Well, just as an example, we take care of a lot of kids with really weird things and kind of out there, you just don't hear of. So we were caring for a little girl that has something called White-Sutton syndrome, and Dr. White and Dr. Sutton are the two doctors who discovered it. So anyway, she was at the office for just a routine physical exam, and we did ear ozone. And her mom typed back when she got home. She said, "Oh my gosh, um, Lacey, on the way home, because she's also autistic, she said she was so much more alert." And this was just doing, ozone, 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 ozone. Three is considered one treatment. So much more alert, much more talkative. I mean, she spoke before that. And we're like, we're going to get one of those home ozone generators. And I'm like, yes, this is what I've been asking you to do for so long. So, seeing those results. Somebody had said, so the ozonated glycerin, what we're doing with the biocidin, it was interesting. Our compounding pharmacist um, told the patient, well, biocidin's not sterile. Why are you breathing it in? Well, I'm like, the air we breathe isn't sterile. So come on. So we usually use 5 to 7 drops of biocidin liquid drops in one vial, which is either 3 to 4 milliliters of 3 to 3.5% hypertonic saline, and then 2 to 3 drops of the ozonated glycerin, and just nebulize it. And that, and a good nebulizer, not like a bad nebulizer. So McKesson makes a really good industrial strength nebulizer, so you can write a prescription for that, and they can use their HSA or FSA funds for it and take it to a medical supply store instead of these wimpy little nebulizers that a lot of pharmacies carry or free to, nasty little battery operated ones. So,
So
yeah,
you get your patients, your kids doing this at home.
yeah, yeah, exactly. We offer that to all of our patients when they're in office. They get a complimentary insufflation. And but if they're sick and they're coming back, they have to buy more to come in and have that done. But if they, I'll write a prescription for a nebulizer and have them get one of those. Now, somebody said, is it BID, TID? I think BID if you're dealing with an infection or if you're dealing with Marcon's colonization. Um, and today, I just met a family where they're at. They have an autistic young man, and they don't really know if they're going to be able to get the nebulizer by his face. There's no way they're going to be able to do sprays up his nose. So I just said, start out you and your husband modeling it so that you're sitting there holding a book or, just breathe it in together. It will do no harm. It will only help. And then he ought to get comfortable. And this might be the only time that, okay, you have the device right here and you have the nebulizer right there. So none of us want our kids on all those devices, but that's the 8 to 10 minutes that it's focused time to get that treatment in. So,
All right, so then I also think, obviously, you do too, about gut health and the gut-brain axis and so forth. Are you doing much of this rectally for kids? And I'm sure
no,
some of this depends on like what the child can handle.
yeah. No, we're not doing hardly any rectally. I mean, if I think for a couple of our kids, no, we didn't do that with him, only with adults. It's just such a violating thing, if you think about that. But I do encourage people if they purchase a home ozone generator, I'm like, they need ozonated water 3 times a day. If you can get your kid 4 ounces of ozonated water 3 times a day if you own a home ozone generator. But let's face it, if people have one, a lot of times they fall off the wagon and they're not doing it or they forget about it. And it's like, okay, you've got your ozonated water at home and you're going to be able to change the gut by using this. So use it. But no, don't do rectal.
Yeah, I've done it a few times, but only on fairly young kids that, may not have known that, like the 2-year-old.
Yeah.
I have a great story of a 2-year-old with alopecia who we did that on and a handful of treatments and her bowel movements improved, her mood improved, her immune system improved, and sure enough, she started to grow hair too. So it's just a testament to what happens when you improve the gut, even though her mom didn't think there was anything wrong with her bowel movements and her moods and her sleep and her immune system, but she noticed afterward how they improved. But that was a child, probably young enough to where maybe that awkwardness and just intrusiveness was maybe a little less. But especially certain kids of ages, you definitely would want to stay away from because they're very aware. And
Yeah.
so are you having them swallow and do the ozone glycerin? Glycerin is sweet. So
Yeah,
for even these
yeah,
kids where their palate is a little bit stubborn,
yeah,
I'm guessing they will do the ozone glycerin.
yeah. You can do that, but it's pretty pricey to do that. So I was just telling Kim, let me go back. You talked about rectal. I do have a little boy that was neurotypical until he was 3, and he had a near drowning episode. And he has a catastrophic injury and he's on a vent at home at night, but he comes in and gets IV ozone here in the clinic. Mom bought her own home ozone generator and she is doing some rectal ozone at home with him, but that's just a totally different situation. As far as the swallowing the glycerin, the I've told a few people, especially if we've got kids with horrible dental caries, but another indication is these kids that have PANS, which is pediatric acute onset neuropsychiatric syndrome. PANDAS is when strep is involved. It's kind of like a subset, or they may not meet the criteria for that strictly, but they have profound brain inflammation. And we have a lot of these kids have their tonsils removed. So one of the things that we have found is that we do, it's a company called Microgen DX. Microgen DX is based out of Lubbock, and
Hmm.
it's a DNA, it's a PCR, next generation sequencing. So the ENT doctors will send a bit of the tonsil, and um, we see just this disgusting biofilm. And so if we get back a bunch of gram negatives and the dentition of these kids is not the best, when we get that back, it's usually within 5 days, we'll have those results. Many times I'll tell them use a half of a milliliter in the mouth if they're old enough. Once their tonsils, you're not supposed to gargle that much, the scabs are falling off, that kind of a thing. But to put that in their mouth, swish it around, make a bunch of spit, and then swallow it. Because there's a bug called Fusobacterium nucleatum, and it's associated with colon cancer, Alzheimer's, but we see it in our kids with neurodevelopmental challenges. Now, a little bit is okay, like about 6%. But if it's more than that, like 18 or 20%, that bug is making an endotoxin that's punching holes in that kid's blood-brain barrier, driving endotoxemia all over their body, making them crazy. And we've used the ozonated glycerin orally, just a smidge, in the mouth afterwards. So just a little bit, little dabble do ya. And
It's
that's
incredible.
been that's been wonderful too. So
Incredible. Um, you have all this specialty on the differences between pans and panda and mark-ons and like I said, microbiology just comes to mind when I think of you and you just recall it so well. But um, is there a difference between all of these and how you apply I mean, you just gave an example, but ozone the ears, ozone glycerin nebulized, is it like a foundation of your protocol, kind of regardless of what the kids come in with, because
yeah,
its approach is kind of blanketed to a lot of infections or colonizations?
yeah, our neurotypical kids, when they're in the office, we just give them ozone. We just do ear ozone, and if they're old enough to, hold their breath, we'll do nasal. And we're just like, this is your common cold fighter. And we have people all the time saying, "Can we come in and get some ozone?" We're like, "Sure." They buy their little set and they come on in, and but, even when we're not targeting bad bugs or anything like that, there was somebody that said, do you use the same dose for adults? Are you talking about the nebulized? If you're talking about the nebulized biocidin and stuff, let me know. I would say grown-ups, I'd use more like 7 drops of the biocidin. It's not cut or dry. I mean, cut and dry. And yeah, just a small amount of the glycerin. Yeah. But remember the surface area. Okay. Yeah. The surface area of an adult is so much more than what a child's is. And so, and even the nebulized glycerin for sinusitis, I mean, that's a great thing to use too. And if you combine it with a little biocidin, you can't go wrong. But that is on the Biobotanicals professional side of the website that you can get in and look at their protocols. They've got all kinds of protocols on there, which is kind of cool.
And we are talking a little bit about OG Pro in terms of protocols for ozonated glycerin. They have a webinar this Friday that I think is still open, even though they've got hundreds of people attending. If you go to ogpro.org, you can register for that, and Pure O3 is sponsoring it, so they've got a place to register from their website too. But I just got the book. You can get the book at OG Pro. And it's small. You can read through it in a few minutes almost, and it's got protocols in there. I did my first nebulized ozonated glycerin for an adult. She's my staff member, and she had been in Florida fixing up a house that she has there. And so she came back, just her nose and throat, even lymphatics, ears, her throat especially was just and nose, just on fire. She said, I found everything, the dust, the termites, the mold, the paint, everything that she had been exposed to in the 25 days or so that she had been there. And I had just gotten my sample from Puro 3 in the mail. And I said, okay, we have an urgent care next door. And so we were like, let's go get a good nebulizer, sit down with this. And it was the one thing that she said had really helped her and turned the corner for her. And mark my words, as we were talking about the weather earlier, with fires, I think in certain areas going to be really bad this year. I got the protocol initially not just from OG Pro, but from a provider who treats. He's an ex-firefighter, and he started a practice in Tijuana for the purpose of helping firefighters or EMT or
Mhm.
emergency teams. And he started using the ozonated glycerin for those patients who had some of that damage, whether it be acute or long term, and just is fallen in love with it. And what I did there, so I followed his, and it was zero point 0.5 mLs of the ozonated glycerin. In the rest of it, I just drew sterile normal saline from an IV bag, put in there. I didn't know about the biocidin, so that's another thing to think about and add on. But I just did that zero point 0.5 for her as an adult with the
Wow.
sterile water, or sorry, saline.
That's really cool. It makes so much sense. The other thing is when you think about the ozone and when you think about all the inflammation down in the lungs, fueling the mitochondria, helping everything to return to normal. Um, the thing that causes proliferation of the muscles is a cytokine called transforming growth factor beta 1, TGF beta 1. And so those ozonides are going to be just a wonderful thing for that. I literally had a conversation with a family today. Their child has cough, diarrhea, and asthma, and they're nebulizing the glycerin and the biocidin. And they're like, they're just sticking with that, and that's working great for him.
Yeah, I bet he gets great results with that. I mean,
Hmm.
like I said, I think allergy season, I think cold and flu season, I think fire season, I think this could really be a go-to. It's not going to be an enormous moneymaker in anybody's office, but this ozonate glycerin, it's so much easier than the syringes, right? You got to have kids and people hold their noses and it can kind of burn and be uncomfortable. You can do it, but the ozonated olive oil to make ozonides, I don't ever do it in my practice either because of the space and the time and the mess and all of that. And I think this nebulized formula with the glycerin is like I think the best so far. And we know that that glycerin is a different carrier for the ozone and might even be making a different molecule versus an ozonide.
Yeah, I don't know. I just know I love the stuff.
And this whole, I was talking to the Pam Holloway. I think it was just yesterday, day before, I was talking to her, who co-wrote this book and is part of the OG Pro program. And we were talking about the power of glycerin in terms of bugs and cancers because they love sugar. So they identify the glycerin and soak it up, but of course it then becomes an oxidative, buster to any of these organisms, tumor cells, whatever the case may be. Obviously, too much sugar is a bad thing, but the combo is creating not just a different molecule, but a mechanism that some of these things allow in. It's kind of masked with that sugar component, but doing really good things to the bad stuff. So.
Cool.
Um, let's see. Aaron, it's nice to have you. Okay, Wesley, zero point 0.5 mLs of full strength in nebulizer with how much saline? So, we did 5 mLs. It was 5 mLs of saline with the zero point 0.5 of ozonated glycerin. That's what he had me do. And in our nebulizer, that's about all that fit. It's a small space in there. So, um, okay, so we talked about like kind of using ozone as a blanketed therapy that's pretty safe for everybody, no matter what they've got. That said, is there anything in terms of safety that you would caution anybody, especially in terms of kids, but anything to look out for, any reasons not to use ozone in ears and nose, even IVs, even though we haven't totally talked about that yet?
Yeah, as far as ears and nose, some children, if they have PE tubes, it's not an absolute contraindication, but everybody responds differently. I have some adults that have like permanent pressure equalization tubes in their ears, but I have had a child that had PE tubes placed. Then then they came out and she had a micro perf and she screamed when we used the ozone in her ears. So it is really patient dependent, even if you're going really, really slow. So that might be a precaution that you just you start with the ear that you know is okay, but you also try to look around and see. And sometimes you can't see those micro perfs, but I've had a few kids like that that have perfs that they just can't do ozone in their ears. So, yeah, that would be a precaution.
Okay.
Yeah, that's about it.
Do kids herx from ear and nose ozone?
Oh yeah, baby. Everybody herxes, and I'm assuming everybody knows what a herx is,
I
but
was going to ask you for your
yeah,
definition of that because I
yeah,
think it's overused, and I think you're
yeah.
the lady
Yeah.
to really straighten out the facts on that.
Well, the first biotoxin experiment in the United States was in Tuskegee, I can't say it, Alabama, where the US government gave a bunch of African American men syphilis. And then they gave them penicillin. And Dr. Jarisch and Dr. Herxheimer watched these men as they received the penicillin, where syphilis is a spirochete, a lot like Borrelia is. And when the penicillin went in and the syphilis basically exploded, it was like a bomb, went off in the body, and it was a healing crisis, meaning that before they got better, they got worse, meaning that when the bug died, they had, maybe shaking chills, headache, fever, fatigue, appetite went away. And a herx really shouldn't last more than about 2 to 3 days, because then that was a biotoxin illness. Syphilis released the biotoxin, the crap is cleared out of your system, and then you start to feel better. The inflammation starts to go down. So that's a herx. If it goes on longer than, 2 to 3 days, you need to be thinking about a condition called secondary porphyrin dumping. So, what are porphyrin rings? Porphyrin rings are what our red blood cells circulate like 90 to 120 days, and they go to the liver to be degraded like a heme molecule. So, you could run, if you're seeing somebody that you do like IV ozone or and then they're just feeling terrible for, 5, 7 days, and you're throwing all kinds of things at them. You can order, at least through LabCorp is what we use in Quest, you can do a random urine porphyrin test. And if you overload the liver with dead and dying crap, okay, and then they may spill out of their liver and into their pee these porphyrins. And it's not primary porphyria, vampire's disease. It's not the same thing. So basically, it's just liver support, and you just go really gentle. So, like milk thistle, eating naturally occurring sugar, like honey, maple syrup. Maybe I probably would not do the glycerin because it would cause them to herx even more. But dates, eating a piece of fruit, and then using activated charcoal or GI Detox Plus. So that's something to think about. So naturally occurring sugar, rice. I'm not a big rice advocate, but brown rice. Um, black rice, more of an ancient kind of a rice, because there can be some gluten cross reactivity with that. But so a herx is 2 to 3 days. So yes, and children can have those. What do we do for Herxheimer's? Herxheimer reactions, anything that lowers inflammation. So we increase fish oil, we increase vitamin D3 plus K2. I don't know if you guys are using PEA, palmitoyl ethanolamide. That's a really powerful thing to use too. I'll just stop there. I'm blabbing. Ah,
So for herxine, PEA.
PEA, there's Neurobiologics makes a PEA with resveratrol, and then also Vitalitus, Vitalus. The molecule is similar to anandamide, which is called the bliss molecule, and but PEA is so powerful. Like one cap is typically about 500 milligrams, and you can take 3 to 5 of those things 3 times a day, and it literally can kind of pull somebody off the ledge. We also use, specialized pro-resolving mediators, SPMs, you can use that, and lots of fluid, Epsom salt baths, vitamin C, those kind of things. And you just go lower and slower, and you just back off a little bit, and you let them kind of recover. So, yes.
This is a little bit of a squirrel moment, but I was your patient for a short period of time for a specific reason when I was there, and you gave me a neurobiologics product, and I haven't bought a ton of it, but you gave me some of the time I bought that one product, which is glutathione, and it was a topical glutathione, and it reminds me you're a big glutathione fan.
Yeah, I am. I mean, yes, I am. I am big time.
And you do those topically mostly for kids? You use that
Yeah,
biologic still?
well, we use oral when they can take oral, and it depends on their precision genetics. I use a genetic company called Fagron. It used to be called GX Sciences, and they let me build my own little panel called the Wellness Blueprint. And um, if the kid can take glutathione, we do it orally, especially if they have really bad detoxification genes. And, liposomal is going to work better. We try all kinds, like Quicksilver, research nutritionals. Oh, I've got like a bottle of it sitting here on my desk for
Mm.
myself to take. There's watermelon, there's orange, there's
Does
also
it
new.
really change the taste and the flavor and the smell? Because glutathione is.
No, not too much. Not too much. I mean, I would say, and I'm not a big juice fan either, but sometimes something a little acidic can kind of cover a multitude of sins. The Quicksilvers, cocoa mint, it's not that good either. And once a kid can swallow capsules, it's like, yay.
Yeah.
So, but yeah, but if a child has eczema, I have them put a big barrier cream, like, beef tallow, good
Oh,
beef,
yeah.
yeah, a ton of beef tallow, fill all the cracks, and then shake up that glutathione topical and put a pea-sized dot and smear it. But you know what our new go-to is? A little bit of topical ozonated glycerin. I
Well, I
mean,
know Micah at Simplio3, what's the name of his product company, though? He has a beef tallow with ozone in it.
oh, wow,
Yeah.
maybe we need that
I
one.
don't know if Toby's done that yet. Those guys tend to compete, neck and neck, but I know that
Yeah.
Micah has with Simplio3 or I can't think of their product line, but he's got a beef tallow with ozone in it. I bet you
Yeah.
could mix I don't know, the beef tallow with the ozone and glycerin.
The problem when you have really tender, you have to be careful when you're using ozonated products on skin that's broken out because the child can herx too from that. So
Hmm.
they might be a lot more miserable. So sometimes you just kind of mix it all together and do zones. We use a lot of topical ozonated olive oil and ozonated coconut oil for diaper rashes too here at the
Mhm.
office, because you're not creating resistance. And if you don't, want to use nystatin or something topically or whatever. So,
So one of my preconceived questions for you was going to be what are some of the overlooked symptoms of any of these conditions that you see in kids or adults? And now I feel like you see such obvious cases, but you have such strong um, a strong presence of neurological that come in. Is there always a hand in hand with the infectious mold, Lyme component with the neurological?
Yeah, if you have kids that are having like global meltdowns, that just aren't really commensurate with what they're told to do, like, Susie, go get your coat. We're going to go see grandma and grandpa. And they throw themselves on the floor and they have a global meltdown and you can't get out the door. But there's not another obvious reason, like they've been well fed, they're watered, they've had their nap, that kind of a thing. Um, and where it incapacitates the family and where all the attention is being given to that one child, and it may only manifest itself neurologically, a neuropsych. You're thinking this kid is a whack job, and but there are things you can find on physical exam. I don't know if you guys are familiar with Bartonella stria, like lift up the shirt and look across the back. Now, teenage boys do tend to get some pretty predominant horizontal stria that is not abnormal, but you kind of have to put everything together. And then y'all have probably heard of Dr. Horowitz, who came up with the multi-symptom questionnaire. It's a validated instrument, they call it, but you have to use good medicine. Um, it's so hard with vector-borne illness and children. And, you know, even little children, I think the youngest that I've diagnosed Bartonella in was in an 18-month-old that was very hypermobile. And she was a little jaundiced and she had just some real subtle developmental delays. And we tested her, and sure enough, she was positive for Bartonella. We used herbal drops. And I don't ask parents to ask leading questions, but spontaneously, this little girl said, my feet hurt, or owie, my feet. And then she had some skin lesions, like y'all are probably familiar with granuloma annulare. That's one of the cutaneous manifestations of Bartonella. We just did the herbal protocols. There's all these good companies. We like Nutrimedics. There's Beyond Balance and, Byron White, all the others. Get the free training. You can do that too with biocidin, but you know, I'm really loving Nutrimedics, and they'll do a lot of free teaching for your team and, help you with the protocols. There's a PA on staff with them that, I mean, she's a rock star. Her name is Teresa Haller, and she teaches for them, and we've learned so much from her. But, little kids, they may have no neuropsychiatric symptoms, and it may all be musculoskeletal and stuff like in the case of this Bartonella, or it may all be ADD, ADHD, ODD. They're getting all the psychiatric labels, and it's so sad when they come with multiple medications. Nobody's bothered to look for hidden infections. So anyway.
So maybe you kind of threw it out there in different ways, but what are your favorite labs? What are your favorite diagnostics? If we've got people listening who are like, I'm not a
Yeah.
specialist for
Yeah.
pediatrics, but what is a reliable, learnable set of diagnostics that I can use?
Well, my new favorite for testing, I'm going to put here testing for VBD, vector-borne illness, is the AccuDart because you can order it and do it at home. There's IGeneX, I put it in the chat. There's IGeneX, there's Garmin that gets shipped off to Germany and all this other stuff. But these folks are coming to you, they're spending money to come to your clinic, and you really need to look at their symptoms. I will tell you that Beyond Balance has some really good webinars, but Nutrimetics does too. So if you are brand new into, you don't want to go down the Lyme rabbit hole or Bartonella or tick-borne relapsing fever or Babesia, I think you can learn it best by reaching out to Nutrimetics and asking them to do training, lunch and learn free from them. They will do that with your entire team. And it basically takes a high index of suspicion. Like if they have a lot of the symptoms of these illnesses, um, now that AccuDart, they'll run specials every once in a while, but like the comprehensive IGeneX testing can be over $1,000. I mean, it's just ridiculous. So this is $4.99, potentially $3.99 when they run specials. It
Mm.
can be done at home with a blood spot and put in the mail. And it doesn't, you know, it it if it's there, if it's positive, then I would just treat them because if they go untreated, don't like mess around going, do they have it? Do they not have it? Do they have it? Do they not have it? Assume the worst and low, slow, and gentle. I'll also throw in there that one of my favorite go-tos for Herxheimer reactions is a Nutramedix product called Berber Pinella. It's Burberpinella, and I'm just going to put, whoops, I put three L's, Nutramedix right there. Oh, yeah, Holly, you'll have to send it to everybody. Um, it has two herbs in there that are anti-inflammatory, and basically, as a baseline, you can do one dropperful in an ounce of water. Um, I have people get a glass, shot glass, and put an ounce of tap water. You don't have to do special water, and you put a dropper full of this Berber Pinella in there, and you let it sit, swirl it around, and slug it down twice a day. But if you start to feel bad, and we actually have Berber Pinella in our IV room, if people say I'm feeling gross, I feel yucky, we have them buy their own bottle of Berber and bring it with them. But if they don't, we have it in there, and we give it to them every 10 to 15 minutes until they start to feel okay. So it's a really great Herx tool too,
Mm.
um, and adults and children alike. You can put it in 6 dropperfuls in a 16 to 32 ounce water bottle and sip on it all day too.
That's really good to know. I think most practices are familiar with a Herxheimer response, or at least what we think is a Herxheimer response. People feeling crummy in the IV room, and so some simple tools at that point are. I agree with that. We used to keep choline and ginger and some other like just simple
Oh,
things to help people with their nauseousness or their yuckiness feeling in the IV room when I was working in Lyme disease, which was years ago before we had a lot of these different products and different tests and all
mhm.
sorts of things. But definitely the feeling crummy in the IV room is really normal. So for your kids and your adults alike, what are your favorites as an IV? I mean, how are you doing IV therapy for these same groups of people?
Yeah, so if, for example, if we're going to be treating a child for any type of infection, we'll just ramp them up on ozone. We don't have EBU at our clinic. Um, uh, and plus, with children, you have to be able to, it's hard to get 2 lines in, let alone one. And a lot of our kids that are really sick have PICs in them, like we send them to the local children's hospital to get a PIC put in. And we'll do dressing changes. We'll, close a room, slip a mask on, and do the dressing change. Or they've got home health coming to their home, to their home too. But we will a lot of, you have to remember that with kids, you typically don't want to go more than about um, 20 cc's per kilo to not overload them with fluid. So it depends on their body weight. So we will customize the total volume of their drip. And we'll make a custom pediatric drip, but we always have vitamin C in there. We don't do high dose IV vitamin C on children. I haven't done that. We don't do pediatric oncology, although we have had a child that presented to us rather late with an oncologic thing. But um, so we'll put vitamin C in a drip, and then maybe at the end we'll do like a little glutathione push. We'll put trace minerals, we'll put magnesium almost inevitably, and we'll do a B complex and sometimes hydroxycobalamin. But it's more like a Myers for a child. But if we've done other testing, like if we've done like a metabolomics, like a urine organic acid, and we show that they need carnitine, we'll put that into the drip. We have Toradol in our IV room too, and we'll use that. We've also put in, so those are just the basics. But we also have like a little immunity drip, which is just some vitamin C and some L-lysine and some magnesium and just little versions. But for the kids that are getting ozone, we'll typically do saline with vitamin C as the most abundant ingredient, and then we'll also do glutathione piggybacked onto that too. And depending on the age and how severe it is, um, I have I have kids that, will do clear up to 2,000 milligrams, just depending on their whole clinical presentation. That's a lot of glut for a kid. So, but most of them, it's about 600 milligrams of glutathione. So, if you've got a smaller prepubescent kid, I would max out at about 600 milligrams of glut. Um, 600 to 800 is what I
Yeah,
would
that's
do.
really good parameters. That's really good advice. And I know one of the questions we get a lot is on the standard major out chemotherapy, which we did write out these protocols, but how much blood can we draw? How much heparin can we use per kilo?
Yeah. Okay. So we did the math a long time ago. Um, oh, Courtney, hey, how are you? Um, okay. Let me see.
Did you guys first meet at SopCon?
Yes, we
Yes.
did. Yes. And I've referred people in Indiana to Courtney. The question went away, but okay, back to the original question. We Years ago we did the math and we made it just really uber simple. And the max blood that we ever take out from a kid, regardless of their age, is 60 milliliters. 30 milliliters is what we start out with. We did all that math. It's just keep it simple, stupid. You don't have to go through and calculate, okay, they get this much, this is this much gamma, all that stuff. But if I have a child, if I have a young girl that started menstruating, I put her on an adult protocol. Okay, because
Hmm.
she's a woman, and you would code her like an adult. And then with the boys, usually around 15 or 16, I'll bump them up to the adult protocol too. I mean, I'll start them out a little slower, but like I might jump. And then what was the question that Courtney put in there? I'm so sorry.
Said how many milligrams per kilogram do you use for a normal vitamin C infusion?
Okay. I don't do it based on milligrams per kilogram of vitamin C. I'll tell you what I do. High dose IV vitamin C is 15,000 milligrams or more. And then when we do high dose, it's usually 25, 50, 75, and maybe 100. So for a kid, my traditional, I'm sorry I don't have that value for you. My traditional amount that I throw into an IV, Courtney, is, let me see, what is 10 times? Yeah, it's not very much. It's like 5,000. I
That
keep
would
that.
make sense to me though.
Yeah, it's like 10 milliliters of the, what is that? 500 per ml is what your traditional. Yeah, so I'm picturing that. Yeah, so it's 5,000 milligrams. Is that 5,000 milligrams or five? It's 5 grams.
Yeah,
Yeah,
so 5 grams.
five
Yeah,
grams.
that makes sense to me. I mean, your
Yeah,
IV franchises for a walk-in adult is doing 5 grams. If we go in, we can start 20. I agree with you, high dose around 15, 20 grams on an adult. So a child would make total sense to me to start about
yeah.
five.
We use five. Yeah, yeah.
And same thing when they get to be girls are menstruating, boys about 15 years old, you can start to go up.
Yeah, yeah. And it's interesting. I've got it sitting here on my desk. I could look it up, but you probably own it. It's Paula Anderson's book.
Yep,
This.
that's learned
So
everything.
yeah, so it's like just open it up and figure it out. We just tried to keep it simple and just make out our little, like our base pediatric drip, and we're going to do a custom is we'll do 500 milliliters, whatever the normal saline is, and then just go ahead and put in those 5 grams. And that's
Are
usually our base.
are there elements of a child's immune system that function different than an adult's, though? I mean,
Yeah.
if you're going to trigger immune function, you're going to trigger, like vitamin C donates electrons. If you're going to start ozonating, regardless of what their condition might be, does a child's immune system respond different, or even an inflammatory response? Is it any different?
Yeah, that's a really good question.
And by
It's
inflammatory, I mean healing.
Yeah, kids are much more resilient. They've been sicker for a shorter period of time, and there are kids who come to us that began with suppression of their immune system because their mom lived in a moldy apartment or home when they were pregnant with them. They came out of the womb with a screwed up immune system, but they're very resilient and and speaking of like regenerative medicine, we're getting back into giving our extracellular vesicles, you can't say exosomes, and stem cells, they're human cellular tissues and products, giving them IV again. Kids get well so much faster, so they tend to bounce back much faster. And when you hit two, um, uh, changes in the immune system take place too. But I'll just say that kids are just delightful. They just don't stay sick and down and grumpy and nasty as bad as adults do. So anyway, yeah, I can't really opine a whole bunch more on that. I mean, but yeah, I hope I answered your question.
Yeah, it's just again like what you're looking at accomplishing with the patient and how that might look different. Obviously, sometimes it's about the threshold for a dose. Sometimes it might be how much blood volume can you take out of someone at depending on their weight. Sometimes it might be the condition that you're looking at, but it seems like there's a fair amount of those factors you're looking at as P.
Yeah. I think the youngest ozone we've done in the clinic is 3 or 4. And um cool, cool. Yeah, true dose. I mean, I wish I could afford a true dose machine. I'm looking here at what Courtney said. Recently done EBOO. Yes, prep them before true dose. Yes, ticks, independence, verbal, because our office was used to having EBOO. I haven't seen him back. That's a good sign if you haven't seen him back. That's really good. It's kind of like no news is good news. So that's really cool.
That's really good for everybody listening. Obviously, you've got to have the age group, even if they're under 18, to do this. But Courtney's one of our very first EBU providers. I don't know if I knew that you had Trudos. I know I talked to you, Paula, about it because the research there is so strong towards
Mhm.
restoring gut health as well as infections. And the thing that got him going was his own child who was
Yeah,
diagnosed with lots of these neurological slash
yeah,
invader, diseases. But um anyway, it's the combo there has had some really good results. And obviously you've got to have the kids old enough to get the two lines in and, and
yeah,
draw that. But it's also interesting to think about doing something like that on a young kid because as you said, they're young and
yeah.
they've got the innate mechanisms probably a lot more intact than we do
Yes.
and their own growth factor, their own stem cells. So I did want to ask you about that in terms of
Mhm.
using extracellular or whatever you want to call it, human tissue products, as well as
Yeah.
peptides. Do you use
Yes.
peptides for your kids?
Yes, we do. We use a lot of BPC 157 and KPB because just for the healing potential, but also for those of you who are like in the mold world, there's a neuroregulatory peptide called called or a hormone, excuse me. Well, it is a peptide. It's called melanocyte stimulating hormone. And it's really hard to get that up. You want it to be 35. And using BPC 157, body protection compound, it's manufactured in our body. It's great for the gut. It's great for neurologic and for lowering inflammation. It's really great for inflammatory bowel disease like Crohn's, lymphocytic or collagenous colitis, and ulcerative colitis. And uh, Quicksilver has an extremely expensive but liposomal delivery with a little phosphatidylcholine
Oh,
thrown in
right.
with it that is pretty much tasteless. But it is uber expensive. It's like 210 for a bottle of the stuff. So we tend to use the little caps on people who can take them, the BPC 157 kPV. But you know what you were saying, Tapley, who started the whole True Dose. There's a provider south of me, and we've had a lot of conversations, and I just couldn't pull the trigger. But platelets on the surface of platelets have so many healing things, and he's created an algorithm where you take the kid's own blood, you determine how much to give him back, it processed, and it helps, and people see a lot of really good results with that. But yeah, peptides are great. And then, you know, I don't do joint injections and things like that. That's something I'd like to learn to do. And I mean, I took, course on that and all that, but it's just not my wheelhouse. So, you got to pick what your wheelhouse is. But when we do exosomes and stem cells, we do them IV. We have ultrasound and pediatric nurses that worked at Texas Children's that I worked with, and we identify the vein, we stick the IV in, we thaw the extracellular vesicles, and you guys probably know Vidi Labs or VD Labs. These are donated placentas of C-section moms. They have been screened for all these illnesses, like Lyme, hepatitis, Zika, HIV, all this other stuff. And they have a tissue banking, it's FDA regulated because there were so many bad actors out there. And right now, no COVID vaxxed moms too of the specimens. And so you just have to watch what you say. You can't make claims, but if you put in all those growth and regenerative factors and you fill in all the nooks and crannies and then you slam in the stem cells, they're going to go to where the inflammation is greatest. They're off of anti-inflammatories for 2 to 3 days before and afterwards when you do that. And you can see, an increase in critical thinking and speech and all those other things. And so, okay, enough.
I want to start to wind this down because of time, but at the same time, I could go on forever. But a thought I have, and I'm not going to hold you to it. I know you're a provider, not an attorney. But for anybody, and I'm guessing you still have your legalities to look out for when you're doing these non-FDA approved things for children, even as a pediatrician. But do you
Yeah.
have any general advice for anybody who may not be a family practitioner or a pediatric specialist on how
Yeah.
they navigate this with some of these non-FDA things?
Yeah. With regenerative medicine or anything, I would just say that we have a consent that like covers everything, but when we talk about regenerative medicine, you just don't make claims. You can't make any promises. And it's just like, you've taught us too with ozone is that, listen, there are no promises, but what are you getting outside of our office? What is allopathic medicine giving to you or your child? They're just giving you more drugs and uh, more medications to mask symptoms, and then you have more side effects. So why don't we try something that has an incredibly low side effect profile, but we're going to make you aware of all of them, and you're going to sign it. You understand this, and just have that beautiful relationship with your families. I mean, I see somebody walking to the IV room, this little girl with terrible mycoplasma and horrible ticks that we had to put on IV antibiotics and throw pick in and do ozone. And we're just hoping and praying. And it's like I'm reaching out for help too. I see your mom in the hall, give her a hug. And it's all about the relationship and the love and the care that you have with your families. And, just keep that up. And, yeah, you can't make promises and don't put anything out there on your social media that X will heal X. You can't make that claim. Only God can make that claim, you
Sounds
know?
like whatever it is you're using, that you take the approach of an education from, you've simplified it, but an education standpoint on what is ozone, where did these stem cells come from? Not using that term, but
Yeah,
just how might the body interpret this information and utilize it, not not any, even though Video Labs does have some trials going with kids, autistic kids and
right.
so forth, and they've had, and I think they're in stage 3 of
Yeah,
that. The same could be true for ozone. The same could be true for some of the peptides. And there are cases where pediatrics have been considered, but still, they're still so focused and limited at the
yeah.
same time.
Yeah, I'll have parents ask me questions and right now I don't have time to take a deep dive on some of this stuff. I'm like, it's okay to say, I don't know. I don't have enough to opine on this and just do your own research, bring it back to me and see what you find. And then maybe we can talk about it in an appointment. I'm not going to give away the farm in the patient portal. You know, it's like, otherwise, you're going back and forth and you're giving away your pearls and your expertise. So,
Yeah, and I know that's part of the reason why you included health coaches into your practice, was to help facilitate some of that education and like you say, relationship with your families without it having to be you.
right, right. It's a lower price point. But people say, I don't need a health coach. I don't need a health coach. But then they fall flat on their face and they abandon everything. And it's like you need a cheerleader and you need someone who's tying the pieces. And so we love our coaches. It's hard. It's really hard to get people to buy in. They're like, I can do that. I can do that. And then they're like, I gave up. It was too much. And it's like, so it's meeting your families where they are, trying to keep it simple, even though none of this is simple.
Mhm.
But just meeting them where they're at. Like, I just can't do that. I'm like, okay, so the first thing you're going to do is take the Greek yogurt and pitch it, and you're going to eat coconut yogurt, because we know that casein's going to bind to cerebral folate receptors and drive inflammation. And so meet them where they're at.
Yeah, and I think one of the biggest challenges in medicine all the way around is compliance, right? We can't help people that don't comply. And in this case, you've got this extra layer of parents complying for their kids. And so the cheerleader aspect and probably the communicator between you and the families, right? They help support everything that you've advised and everything that you offer, and also helping the families stay on track with some of those changes that they could make at home. So
Yeah.
I knew I remember at one time you saying like this was a game changer to start to implement some of these, whatever you want to call them, mid-levels or communicators or patient care coordinators or health coaches. But, to keep your schedule where it needs to be and focused on those important conversations that only you can have, and then, have those other elements for patients as well.
Yeah, I'm amazed at how many of you have stuck around. Wow, thank you. I mean,
Yep, yep. Okay, I wanted to lastly say that if anybody, I've always offered this of Paula's office, she's always been so great to accommodate this, but if you're interested in shadowing for pediatric purposes and or the specialty of, she speaks on Marcon, she speaks on PANS and so forth, if that's what your wheelhouse or what you want it to be, then she does accept or at least consider accepting. In fact, when I was in your office, you had like 2 or 3 shadowing you at the time, visiting practitioners that I've still maintained relationships with. But if you're interested in learning more about this, I don't think there's anything better than actually spending time shadowing and next to the providers that do this day in and day out. So she said that, and you can say it too, but she said if you're interested in that, just email a specific email. We'll put it in the chat, and it's hope at get number two, theroot.com and put in the subject line that you're interested in spending time as a provider with her in a shadowing capacity. And then you can get with her in terms of costs and timing and all of that stuff. But it's a fantastic place to be. And again, if this is your wheelhouse, your niche, and maybe you've just got some kids of your own or in your own families where you'd like to learn more, she's incredible that way. So it is hope at get the number two, theroot.com. And she's in Shenandoah, Texas. Really easy to get in and out of, and it's a beautiful place. Unless
Okay.
it's 95 and humid.
Yeah. Yeah. Oh, well, I'm so grateful for the opportunity. Thank you.
Thank you. It's been
And
wonderful to see you again, chat with you again, get updated on all your current knowledge base. And like I say, it seems like we're seeing you speak out even a little bit more and seeing your face pop up in
yeah.
different
I
organizations.
I will say thank you for talking about the Doctor Talks. Are the Fagron sponsored me for a year, and it's the Get to the Root podcast. And if any of you are willing, go on there, like it, subscribe, and write a positive review.
Oh, I
That
didn't
will
know that you had a podcast.
Yeah, that would help. So if you go to Dr. Talks and look me up, but it's Get to the Root. I'm so sorry, but I don't have the links or anything here. But yeah,
Send them to
so
us and we'll post it in the notes for the recording or whatever. We can put that
okay,
in there. And anybody who
okay.
asks.
All right. Well, I sure appreciate it. And
Appreciate
thanks
you,
thanks for having me. I'm really grateful.
of
All right.
course.
Take care.
Okay, everybody, have a good night and we will talk to you again soon.
Okay. Take care. Bye-bye.